Why should we talk about this earlier onset? And I've mentioned this a few occasions now. Because I think this is, and I'm repeating myself here, but it's quite purposely. We should be directing treatment at an early age. Now, there's a phenomenon called neuroplasticity. Who's heard of that? One or two. That's fantastic. I'm wrapped in that. Neuroplasticity. It refers to the ability of the brain to change as a result of stimulation. And as a young child, the brain is very neuroplastic, much more neuroplastic than mine would be, or most people in this audience. And we can do a lot to change the person's brain and rewire it at a younger age if with the right sort of therapy. And we can treat these children very early if we get them early. And they can completely be in remission for years to come. In other words, there's no reoccurrence of the illness. They can be OCD free because of that ability of the brain. 2.5% of adults, now once they get into adulthood, they're a little more difficult to treat just with behaviorally and get a complete remission of symptoms. Mind you, it depends upon the individual. And later life, we really haven't got a lot of treatment studies, but they're much more difficult to treat and reverse them. Males tend to have early onset than looking at the sex differences in terms of the type. Males with OCD tend to have earlier onset and more symmetry and concerns with religion and the religious faith and have miscellaneous compulsions. Males also have a tendency to have, with this disorder, have a lot of attention deficit hyperactivity disorder, and that needs to be diagnosed. The more of attention deficit hyperactivity disorder you have, the more difficult the OCD is going to be to treat. Female subjects would like to be married, have cleaning compulsions, and be associated with trichotillomania. Who knows what trichotillomania is? I'm going to show you a moment what that is. OCD does not occur alone. Comorbidity is common. And what do we have here? Major depression is so common. And this figure says about 70% of those people with OCD have major depression. I believe the figure is indeed much higher than that. Some would say it's close to 100%. They also have what we call some of these OCD spectrum disorders. Anorexia nervosa, bulimia nervosa, and eating disorders. Hypochondriasis, which is a concern and preoccupation with illness. And body dysmorphic disorder, illness I'm particularly interested in. This is where people fear imagined ugliness. More about that later. And trichotillomania, where people compulsively pull their hair out. Now, I said that depression is a common comorbidity. And I want you to go away tonight recognizing that it's more than a chemical imbalance. It's more than serotonin and more than an adrenaline. And one of the reasons which has helped us to come to this finding is this. We're actually more able to study the brain than any time in human history. And one of the things which has helped us what we call neuroimaging. This is using scans. Everybody in this room has heard of an MRI scan. Everybody in this room has heard of a CAT scan. Well, it's one sort of scan which actually looks at the way the brain is functioning. This is called a positron emission tomography study. And here's what a depressed brain looks like. I hope that picture impresses upon you that indeed what is happening with depression is indeed a physical illness of the brain. And I call it as, I look at this slide and I say to myself, it's really like the lights have gone out. Systems are failing. You think about what are the major symptoms of depression? Sleep disturbance, appetite disturbance, concentration disturbance, energy disturbance, and mood disturbance. How many people in this room have got those? Don't put your hand up. But the lights are fading. And what I want to get this across, that this indeed is a physical illness of the brain. Now, we've also got some neuroimaging studies of obsessive compulsive disorder as well. In fact, OCD was the first disorder ever to be shown to have a real brain problem. And look at this. There's a normal brain. There's a brain with obsessive compulsive disorder. And this has led people to say that people with obsessive compulsive disorder really have what we call is a neuropsychiatric disorder. Now, the red and the yellow refer to increased activity in the brain. And people with OCD, their brains are indeed much busier. Now, there's a cause for OCD which people don't often think about, and that can indeed be caused through an infection. And it's a streptococcal infection. There are some people in this country, and also it's a group in New Zealand, and also in the States, which have been the cause of their OCD has been a result of an infection penetrating the brain and leading to a change in the chemistry. Now, this is important. OCD is one of the most disabling illnesses around. It's in the top 10 World Health Organization list of illnesses causing disability. In the next diagnostic manual of mental illnesses, it's quite possible that OCD is no longer going to be classified as an anxiety disorder. Can't guarantee you 100%, but there's real consideration to this. So in 2012, when the manual comes out, if I was asked to talk about anxiety disorders, I may not be able to talk about OCD. And this OCD is going to be included along with several spectrum disorders. And these are going to include, and I'll just talk about trichotillomania. Excortation is where people constantly pick their skin. Onchophagia is people bite their nails. Who bites their nails compulsively here? You're too embarrassed, but there'll be a few more than two. And body dysmorphic disorders where they fear or imagine ugliness, and the eating disorders may all be reclassified into the OCD spectrum disorders. Now, a body dysmorphic disorder I'm most interested in. This is where people fear that part of their body is ugly, and they spend hours and hours preoccupied with that perceived ugliness. And they do a lot of mirror checking. They look in their mirror. They carry mirrors around with them. I had a guy recently who had a mobile phone, and he would take photographs of his face and look at his face dozens of times a day. The preoccupation is a major concern here. They'll look at other people's faces and compare their faces. And women will apply massive amounts of makeup. A little while ago, I had a lady come down from Sydney with her, and she was Greek, and she walked into my office and she said, "My daughter's not coming home till you've fixed her." And she was spending $500 a week on makeup. And it wasn't randomly getting makeup, it had to be specific brands. And she was most distressed that the brand decided to be discontinued. 1 in 100 adults, 1 in 8 patients who are hospitalized. And 1 in 8 to 12, all patients seeking treatment from a dermatologist, and 1 in 5 to 15 patients seeking cosmetic surgery. Cosmetic surgery will never work for a person with BDD. Dermatological work will never work for the BDD, but they keep on going. I've got a patient at the moment who visits a dermatologist frequently, getting peels done, getting laser treatment. It will not cure a condition because the condition is in fact in the brain. I have another one who's gone to a nutritionist thinking that will solve a problem. Those treatments don't work for people with body dysmorphic disorder. It has major problems in the community, and as you can see from this slide, and also increases in diabetes and so on. And trichotillomania is another OCD type spectrum disorder I'm interested in, and this is where people compulsively pull their hair out. And I can look around tonight and I can see a few people which worry me a little bit. But it causes indeed marked distress. And it occurs in children, adolescents, and adulthood. And people often cover their bald patches up, manipulating the hair in a certain way.